Hi there, and welcome to Canceling COVID. I do this every week. I don't know why I haven't figured this thing quite yet, how to make sure I don't have that part where it just shows no one on the screen, but I'll get there. Hopefully, you'll give me a little grace as I continue to produce and bring this all to you. Jeez, it just gets me every time. How you doing on this Tuesday? So excited to have you with us yet again. It's Canceling COVID every Tuesday at 11 a.m. Working together, real talk, real resources, and we are looking for resolutions as we work through this thing called the pandemic. As our young people now are preparing to head back to school, as you know more than ever, whether it's your child, your grandchild, or your great grandchild, your neighbor, whoever it may be, as we're out in the community getting ready for back to school time as well. I felt like it was really a great opportunity to bring on someone that I really value so we can talk about what steps and precautions you might need to keep in mind as we prepare for this as well. First of all, it's a great day, another hot day in the city. We're in the month of August. Seems like everything just zoomed by, but hopefully you've enjoyed what you've set out to do since we are headed into the fall season. Not just yet, though, but also as we have seen things shift around us. And when I say that, as far as the pandemic, we're back in the red zone. Of course, the show is Canceling COVID. And that means that more precautions have been put into place. One of them is masking indoors. Also, a conversation coming up with Dr. Tracia Black as we talk about none other than monkeypox, just to give you an idea of what's going on with that as well. And let me just shout out Groundwater Solutions, groundwater-solutions.org, 704-596-0505. One of our sponsors, and we're grateful for that as well. And also thank you to Atrium Health as they provide information as an ambassador, COVID vaccine ambassador. Always put the hashtag in front of that as well. So with all that said, I don't want to delay too long because I want to jump into this conversation again with someone that's very trusted. I value her feedback. She is a servant of the community and continues to work. I appreciate when I reach out. She's always there. I'm talking about a current school board chair, not chairperson, but member, Jennifer De La Hara. Look, I almost promoted you there, didn't I?
I know. I was like, whoops. Good to see you, Tanya. Thanks for having me on today.
Good to see you as well. So it's back to school time already. And I know you guys have been working really hard. So let's just dive in and help parents out that may have questions because they're busy. Everybody's busy. Things are pulling at them for every direction. Let's start with parents who are like, are we ready for this? Are we ready? Because the numbers are starting to spike again in our community. To that, what would you say to them?
That I think they have absolute valid concerns. I mean, the pandemic is still here, and I don't think anyone's trying to present that it's not. And that they should be reassured that CMS as an organization is taking that very seriously. So we will be following, the same protocols that we ended on at the end of the year. And I can certainly talk a little bit more about that and encourage folks. But I think that's the main thing that what I'm hearing you say is that it's here, and we would agree with you that it's still here. And we will be, following the protocols that have been set out and will be actually discussed tonight. So I'll tell you a little bit more about that.
So let's talk about the protocols that ended, because I know it was only 3 months ago, but it seems like eons, years ago. What were some of the things that were in place, steps that were in place when school let out?
Well, first we should remind folks that masks are optional. And that will still be the case. And I can dig in more with that if you like. Certain protocols around who needs to quarantine if they've been vaccinated or not. Mm-hmm. And, sometimes it's 5 days, sometimes it's 10 days, proof of that. We'll be following those same protocols just to make sure that everyone is safe. And of course, although, this is on our website, we'll be discussing it tonight at the Board of Education meeting. Always know that you can call your school when you have questions. If you're concerned, hey, my child is, coughing or something's going on, I'm not quite sure, and get that information directly so that you feel confident as a parent that you're returning your child to school in the best, health, safety for everyone.
So let's talk about tonight because you mentioned that a couple of times and it looks like tonight is really big. So I'm glad I'm able to get you on today. Tell us what's happening tonight. Clearly, you've got your school board meeting. So please lay that out so that we can help push this out as well.
Yeah, the meeting will start at 6 o'clock. All are welcome at the Government Center. It's also streamed on YouTube and Facebook on our meetings. I would encourage folks to tune in. We will do reports at the beginning of the meeting. You will we'll have a return to school opening report, which will cover many things, including where we are in transportation. Do we have enough bus drivers? Are our schools ready? Just open and clean and ready to go. So it's not just COVID related. However, there will be our representatives there who've been in close contact with Dr. Bernard Washington, our public health director with Mecklenburg County Health Department, to talk about the latest trends and to reassure that our staff have been trained on what they need to do, how we're employing things like our nurse extenders. We've hired and we've invested some of our federal COVID dollars to have extra staff on site to be able to take care of these kids and do what we need to do to keep everyone safe. So we'll talk about that tonight.
So starting at 6 p.m. and people can attend in person as well as online?
Yes, in person at the Government Center and online, to, at least to watch.
So where do they find the link to attend online? And that may be something really easy. Do they just go to the website and click on? Because I'm in a season where I take nothing for granted and assume nothing for when we're trying to get this information out.
Yeah, so on CMS's website, if you go to the Board of Education part, you'll see the YouTube link as well as the CMS Board of Education Facebook page. Now, make sure it's the Board of Education page, not the regular school administrative side, but the Board of Education page. You can, we'll start streaming it right at 6 o'clock and you can just watch it live right there.
So that's good information. So I just wanted to share or ask, and obviously we're back in the red zone, which recommends that masking takes place inside. Where does, because I know this can really be somewhat controversial. Where's CMS with the masking right now in the classrooms?
We will return to fall with masking being optional. And that is coming under the directive really from DHHS in North Carolina and Department of Health and Human Services under the direction of Mecklenburg County Public Health, which is not at this point recommending. I know sometimes it's confusing because I believe you're referring to the CDC's recommendations that when read. So yes, that is true. And it's true that at this point, the Mecklenburg County Health Director is not recommending that we go back to a countywide mask or even within the schools. I do want to point out, if this is any sense of comfort, that, when we lifted the mask mandate back in March, I believe, one of the questions I asked the health director was, tell me what we're off-ramping mask. Tell me what you're going to be looking for when we need to on-ramp. Right. That was one of my top questions personally. And he reassured not just me and not just our board, but the public that he would be looking at those rising rates. He would be looking at hospital capacity. He would be looking at several different factors and that he would be in touch with our superintendent and CMS staff so that we could respond immediately should that be the recommendation. So I hope for those that have valid concerns that they know that those communications continue to happen. It's my understanding that the health director is not recommending. And so we will be going with mask optional. And of course, we highly recommend folks that want to do that to protect themselves or their families, do mask. But know that we will implement, if we're given that direction at the local level.
And we talked about this already once, but I just wanted to come back and revisit it. So thank you for going into more detail because I know that was a very divisive issue. This whole pandemic has created more division than I think anyone even imagined because it turned into something political, which is the last thing that we need after losing so many lives. So thank you for that. Now, parents are sending their children back to school and obviously they have a lot of concerns. Are you familiar with some of the protocols that you all have in place if your child becomes diagnosed? And let me just add though, or if they test positive, where it should be in somewhat a little better shape, somewhat better, since a lot of children also now have the vaccine, whereas before they did not?
Yeah, I mean, certainly, and we encourage vaccinations. We will still be having vaccination clinics and always be encouraging our families to get the vaccine because that is
Mhm.
our number one line of defense.
Uh-huh.
I believe that our staff will only be in a much better shape going into the fall, having already experienced this, unfortunately, for 2 years now,
Right.
to address the needs, to be looking for symptoms, to suggest that children do get tested, and we will have on-site quick turnaround tests and things like that, and tools available to us in addition to having our regular nursing staff as well as the nurse extenders. So our goal is to, make sure those babies are taken care of, and our staff. It is the children, but it's also the staff who have valid concerns as well. So I think now that we've had more practice, I
Yeah.
hate to say it, practice makes perfect, and it won't be perfect by any
Right.
means. But I think the goal, everyone understands that public health safety is a top priority.
What is the school board's commitment to all this as far as making sure that things are transitioning and going along? What are some of the conversations that you all are having or hearing from the community?
Well, we do engage with the community at various levels, and I left a meeting this morning where the people were masking there, or it was recommended, or you were
Right.
asked if you were attending. So I think that's important for us as community leaders to recognize, because while there are certain pockets of the community who generally don't mask, there are
Right.
others that are very precautious, and so I think that's important as we're out and about to take in all of that, feedback and the realities of the health disparities that exist also in our community, and why I think that drives how people feel about the pandemic. Um, you know, my commitment is that making sure that relationship between our staff, namely the superintendent and our person that works directly with Mecklenburg County Health, is in that constant contact. And those are the questions I ask. And when I hear back confirmation that that's happening, I really step out, because I'm not a public health official
Right. Right.
or expert, but my goal as oversight and governance is to make sure those conversations are happening to the level that I feel comfortable that I can step back, because they are the professionals and they're giving us guidance. Us, when I say us, not the school board, giving Charlotte Mecklenburg schools the guidance that they need to make sure that we're being safe.
Well, you're a public servant and you do a great job at it. I just want to ask one additional question before I let you go. There are some parents in the Charlotte Mecklenburg schools system that are probably concerned about the changes. Of course, I know it has been not the easiest as you've transitioned to now an interim superintendent. Um, should people be concerned about all the changes and what's going on?
So tonight we're actually going to be discussing that as well a bit.
Oh,
They're new, so tune in. Primetime TV. Tune in, because there are changes. I think a lot of them are very much welcomed. I haven't heard a lot of resistance to them. With the development of 9 learning communities zones instead of 6.
uh-huh.
What that does is it's going to reduce sort of the workload and allow for more direct accountability and more engagement, I hope, from our learning community superintendents to have a fewer number of schools. I do want to note that we did not increase central office staff. We reallocated positions. And I do think that's important, because people immediately think, oh, you're becoming more bloated, you're
Right.
increasing central office staff. That is not the case here. We took other positions, or I shouldn't say we, the superintendent made the decision to take other positions and reallocate them to strategically, be able to engage with the community. So I think the end result will be positive. I'm certainly open to hearing feedback if folks don't agree. And, you can email me and find that email on that same CMS school board page that I mentioned earlier. But I'm hoping for a smooth transition as we come in, and even more transparency, and giving our learning community superintendents that opportunity to engage at a deeper level as well.
And one last point to make. You're short of teachers, but it's not just in CMS, it's everywhere. Oh, are we gonna make it through this situation?
We will make it.
Of course.
I can't overstate it's a dire situation. And I hope that our community comes together to help us solve it, because it's multi-layered, it's multifaceted. You know, a large part of it is teacher pay. It's not all of it.
Right.
But, you know, Charlotte-Mecklenburg Schools advocates on our legislative agenda for greater teacher pay, or for implementations from the Leandro case, the 28-year-old lawsuit against the state legislature,
Right.
you know, to provide more resources. And when I mean resources, I mean direct people positions, talented individuals who are teaching kids the skills they need, both technical and soft skills, social emotional skills, you know, for a modern workforce. And so, you know, we continue to push for that, and we call on the community to engage with us, to volunteer with us, you know, get your church involved, you know, congregates, you know, come out and engage, because I do think it's going to take all hands on deck. I'm worried about being 400 teachers short as we're coming in. And I hope that the community will realize that it affects us all already, and it's a domino effect for our future. Our kids and families deserve the best.
Jennifer De La Hara, I love you. I appreciate you. And one of the things that you're always able to articulate without even saying it, it's not just on the schools, it's the churches, the community. These are our children, and we all have to get involved and work to give them the resources that they need and are required. So as we wrap things up, anything else? I know the meeting tonight is so important. Again, it's at 6 p.m. Go to the CMS website and then go to Board of Education. Is that correct?
That is right. That is right. One other little thing I would add, if you go to my personal or my forward-facing school board page, I've also put a Zoom link for a school board meeting recap that I'm going to do. And I'm hoping it will start a trend on the Wednesday after our Tuesday night meetings. So if you miss it tonight and you would like to get a little recap of what we're doing, look for that Zoom link and sign up. And that's another way that you can engage with me and maybe get the abbreviated version of what all happened at the school board meeting. So I want to do a shout out to that.
Good stuff. And thank you again so much for taking the time to join us. I appreciate you always being there every time I call on you, and enjoy the rest of your day. Thank you.
Thank you. Have a great day.
All right, you too. Always a great conversation. Always great to have her. She does an amazing job, especially when I reach out. And that's what I'm grateful for. Someone that is obviously a part of our community and working really hard in our community to bring you what we're needed. That way you don't have to try and go by hearsay. It's someone that's absolutely providing what you need to hear. And that's so important to us. And we're so grateful for the conversation from Jennifer De La Hara, our current school board member, always available and always assisting us when it comes to getting great information as we prepare for our young people to head back to school. It's so important that we all work together. We cannot, and I repeat that, we cannot take for granted all of the public officials that also serve our young people. So now that we've got that information, I need to bring on Dr. Tricia Black, our in-house resident expert, who is always assisting us, of course, Groundwater Solutions, Genesis Project, groundwater-solutions.org, groundwater-solutions.org, 704-596-0505. Also a sponsor of this show. So first of all, good morning, Dr. Black. And as always, it's great to see you.
Great. It's great to be here.
Absolutely. So we just talked about some preparations for back to school. I wanted to bring you in kind of because, you know, these kids are dealing with so much. We got the pandemic going on with COVID and now monkeypox. And we know that there's a specific audience or a population that's being impacted by monkeypox at the moment, but obviously it can spread to young children. I saw where in Mecklenburg County, we've got 53 of the 95 reported cases for the state of North Carolina. Those are some pretty large numbers. So I just want you to kind of speak on where we are and what we should be expecting.
Okay, so one of the things that I want us all to be aware of is that there is not a need to panic. You know, one of the things that we're wanting to avoid is the pandemonium that might come from highlighting what's going on with monkeypox. But the reality is monkeypox is a pox virus. Much like smallpox, it is not like chickenpox that spread very easily throughout the community. Chickenpox is not really a pox virus when you talk about the classification of pox. I don't know how it got that name, but monkeypox is a virus that is spread by close, intimate contact. It's not a sexually transmitted disease like some people are believing, but it is spread by close contact, skin to skin contact, and exchange of bodily fluids. One other way that it's spread is by things that are contaminated with the bodily fluids of someone that is infected, and bed sheets, things like that. 99% of the reported cases of of monkeypox is in the community of men who have sex with men. But there is a 1% that is spread that are not part of that population. What we know is that healthcare providers and folks who live in the same household with someone who is infected are typically the ones in that 1%. I've heard people talk about taking their bed sheets to their own sheets to hotels to prevent the transmission. And that is pretty smart. However, a hospital worker, can you hear me?
I can hear you. I'm just laughing because my husband and I just came back off a trip and we took our own hotel, we took our bed sheets. And there's a big story about a minority entrepreneur who is killing the game right now because she created disposable bed sheets. And so that's why I'm smiling.
We are brilliant, aren't we?
We will come up with something like, and that's something not to interrupt you or to digress, but even something we should have thought about all along, because we're trusting that the bed sheets have been washed and they're properly handled when we go in and out of hotels. But I must admit, I always use Lysol and spray mine down before I get on in. And anyway.
Well, here's the challenge with that. To kill the monkeypox virus, you would have to saturate the sheets with a antibacterial or a disinfectant like Clorox or Lysol. Oh, wow. And then you'd have to let it dry
before you can sleep.
Or you can sleep on it. So taking your own linen is intelligent. It's an intelligent piece at this moment. But there's a reported case of monkeypox being transmitted to a hospital worker because they handled the bed sheets. Gathered it up in their arms. So unless you're at the hotel, I heard a doctor say, unless you're at the hotel and you've got on long sleeves and gloves when you're changing the bed sheets, you are still exposing yourself to the monkeypox virus.
So Dr. White, I just wanted to kind of interject when you're talking about that too. I know people are trying to take all precautions, but I want to also go back to what you just said. There's no reason for panic.
Right.
As we talk about what we're doing, and I don't want to give the impression that that's what we're trying to do. Mm-hmm. We want people to just be informed as they move forward.
Right. So I think the reality is that there are many germs out there and things that can get on us that we need to be protective of. I've listened to a swarm of doctors over the course of the weekend that they said, we always wear long sleeves when we're traveling, or long pants when we're traveling on planes or public transportation, that we didn't just start doing that with COVID. They didn't just start because monkeypox is there. They have masked on planes even before the pandemic. And so we need to I think we need to look at what we consider universal precautions for everything, not just the challenges that are really in the forefront today.
Well, let's talk about the children and how they're impacted, because certainly there are reports if a child is in a home and someone has monkeypox and possibly uses a towel. I think the way it was explained, that if you get out of, say, the shower and obviously you put a towel on your body, which is not clothed at the moment, then that towel could possibly transfer monkeypox as well. And again, we've got children that are going to be in these close quarters that are now going to be around each other. What do we say to parents? Because now we're also, we don't have the mask. We have the mask mandate inside because we're back to the red zone for COVID. But a lot of businesses, they're not enforcing it. They really aren't. So I'm not sure what Charlotte-Mecklenburg schools are going to do, but certainly they haven't come out and made that announcement, and I don't see it happening either. So what do you say to parents?
For parents and everyone take precautions, practice good hygiene. Remember going back to washing your hands. Monkeypox is on fabrics, so clothing, towels, bed linens, things like that it can transmit the virus. Now we have to also remember that the number of individuals who are active or infected with monkeypox is still really small. You think about in North Carolina or Mecklenburg County, you said there are 53 cases in the county. Right. And with monkeypox, it is visible. So you can see that you need to take precautions. Very early on in monkeypox, small pus-like
lesions, which are painful.
Which are very painful. You'll see them. They will start with the small raised area that's kind of rough with the gloss over it, and then it will. And here's what I think. What I learned that is very, very important. That it causes inflammation. Most people are most concerned about the lesions. And I heard a doctor say, well, people don't mind being sick, and really and truly, they don't really have an issue with dying, but they do not want to be ugly. It kind of resounded with me, like that is the main concern with monkeypox. But the visible is only a small piece of what you see. Yes, the marks are going to be long-term. They are not like a chicken pox where, they'll fade away really easily. It may last for months or years past the time that you are infected. But when you see those lesions, it represents lots of inflammation inside your body. So your vascular system is inflamed, your organs are inflamed, and that's where the pain is coming from, is everything up under the lesion is disturbed. And so wherever you have become infected, whether it's on your hands, typically it's on your face, because it's spread by droplets, as those moisture that might pass when you're speaking, which is why masking again is very important.
Right.
So parents, make sure that your children are going to be masked, make sure that they're going to be washing their hands several times throughout the day. And when you come in the house, take your clothes off. Remember early COVID, we took our clothes off at the door, so we need to resume to doing those types of practices to ensure that we're safe.
Man, it's just a lot, Dr. Black. It's a lot. I mean, the kids have got to adjust to go back to school. They got to be prepared to adjust to learning. A lot of them are behind already. Teachers are exhausted, and not to mention the shortage.
They're short-staffed.
Yeah. So now we got to
remember a principal yesterday they're 11 teachers short, and school starts in 1 week.
Oh, and all we can do is just keep on hoping that there's some light at the end of the tunnel. We just got to just stay, stand steadfast with our faith and working through all this. But this certainly is a lot. So again, here in the U.S. last week, when we talked last, we were at 5,000 cases. Now it's over 7,000. And of course, President Biden has since announced and declared it a public health emergency. And I'd already kind of shared some of the 3 leading states that were already taking upon that. And you can imagine that at least 2 off the top of my head, I know it was New York as well as California. And there was one additional one. I'll think of that in just a moment. But the whole idea of all of this happening, and you talked about how complex this is, kind of, what do you mean by that?
So, when you look at numbers, such as the 90%, some say 90%, as low as 90%, and some say as high as 99% of monkeypox is occurring in populations with men who have sex with men, and that is significant. When you study statistics and do research, that number is statistically significant, meaning that it tells us something. So right now, the virus may very well be primarily contained to that community. Now, does that mean, and I'm hoping this is an okay topic for the audience, but does that mean that this is a gay men's disease? It does not mean that. AIDS, HIV, is not a gay men's disease. It just happened to start in that community. Patient 0, the first person who contracted this virus within the human community, happened to be a possibly, based on the numbers, a homosexual male.
Uh-huh.
But it could have started with Black women or another population, but it has been contained to that community. It's concerning to me because I think it will make other people kind of think, oh, I don't have to worry about that,
Right.
much like AIDS and HIV. And our lack of concern, our lack of education is what allowed it to spread so rampantly across the world. And so we're, experts are talking about how do we now contain this. It's through education. It's through all of us being aware of what we need to do to stay safe from the virus. It's from those who are possibly at risk for infection. Take really universal precautions to make sure that the spread does not continue, because it will not stay in that community if it doesn't.
And to your point, it is safe to have this conversation because we're about real talk, real people, real resources, and we need to speak to our audience. And one of the things that I've already shared, back to HIV and AIDS, when it started, it seemed like a gay white man's disease. And now all of a sudden it became a problem in the Black community. I think I would be lying if I didn't think, here we go with monkeypox.
Very similar dynamic.
Seems to be a gay white man's disease. It also saying trans women as well. But, before, as time will evolve, we'll more of it in our community as well. I just wanted to say the 10 states with the highest numbers, because it went from 3 into 10 really quickly. California, New York, Illinois, Florida, Massachusetts, Pennsylvania, Texas, Virginia, Georgia, and Maryland. And of course, the District of Columbia included as well. And so
it has progressively over the last 9 weeks, kind of tripled, doubled and tripled. And so with those numbers, it is very alarming at that rate of where we could be in another 9 weeks if something drastic does not happen.
Well, Dr. Black, I always appreciate you again, all of your support, taking the time to come on and share this valuable information. As we wrap things up, kind of what's going on with Groundwater Solutions?
Oh my goodness, there is a lot going on with Groundwater Solutions. We have our readiness review for the tailored care management project that we've talked about a couple of times on the air. You'll start seeing literature out about the tailored care management transition and what individuals who are on public assistance, Medicaid specifically, need to be aware that you're going to need to pick a tailored care management home, or one will be assigned for you. And so just everybody be on the lookout for that. We are also still hiring rampantly because that project, as well as several other projects, including our community health worker program, is really expanding rapidly. So we need folks who have a passion for people, who want to help transform lives, to come to get connected with us.
Well, I have to smile when you say that, because you obviously love our community and love people. So I appreciate you so much for taking the time to talk with us. Again, Dr. Tracia Black, Groundwater Solutions, 704-596-0505, groundwater-solutions.org. Thank you again for taking the time to join us each and every week. Enjoy your day.
Bye-bye.
Absolutely. So great stuff as always. I want to say thank you to our current school board member, Jennifer De La Hara, always available and always willing to join us and answer the call. And of course, Dr. Tracia Black, helping and assisting us as we continue to keep you informed. As you share information, Atrium Health, I want to appreciate or let them know how much we appreciate all that they provide as well. Atrium Health # COVID Vaccine Ambassador is, of course, the hashtag COVID Vaccine Ambassador. As you share, make sure that you're sharing this information as we continue to keep you informed and keep you advised about what's happening. So as far as what's happening for me this week, coming up on Thursday, I'll be the guest speaker for the Lake Norman Chamber of Commerce. They're hosting their women's conference, and I'm one of 4 guest speakers, so I'm very grateful for that. Just back from the National Association of Black Journalists Convention, very grateful for old and new friends, grateful for that as well. And of course, I'll see you on Saturday, Sounds of Inspiration. Tune in at 10 a.m. as I bring you the very best in gospel music at Praise 100.9. That's at 10 a.m. Be well, be safe, be alert, and check on your neighbor, and make sure we're doing what we can to help our young people as they prepare for back to school. It's that time of year. Speaking of that time of year, the Praise in the Park. You'll hear more and more about that. It's coming up September 17th. So anyone interested, vendors, 704-451-0978. I'll say it again, 704-451-0978. Your opportunity to support us. Or if you have any questions, you can just reach out to me, rivenstanya@gmail.com. rivenstanya@gmail.com. Hey guys, have a great day. I really appreciate you taking the time to join us as we continue to bring you Canceling COVID, real talk, real people, real resources as we work together to cancel COVID. Have a great day, everyone, and thanks for tuning in.